body mechanics during transfers with Noah in order to prevent injuries. Noah's grandfather would benefit from education and training in the ABC chart as a tool used in home to monitor Noah's hitting. It was stated by his grandfather that Noah physically will hit others out of frustration if he is unable to express himself or if his electronic device is taken away. This strategy will assist his guardian and support the teacher if his behavior persists and transfers to the classroom. The ABC chart may also be used by other clinicians that interact with Noah if behaviors are exhibited at school. The antecedent behavior consequence chart will be provided for his grandfather and school personnel. The following accommodations and modifications are necessary. We believe that Noah would benefit from using assistive devices like pencil grips and various sizes of writing instruments due to his challenges with writing. He would also benefit from a wheelchair desk to promote independence. We believe that Noah would benefit from oral tests and his answers would be scribed by an aide to minimize the amount of writing. We believe that Noah would benefit from hand signs such as true or false, or multiple choices to significantly reduce the amount of writing. We believe that Noah would benefit from the use of a tape recorder to assist with retention. Noah has difficulty retaining information. We believe that Noah would benefit from symbols to text due to his challenge with writing. We believe that Noah would benefit from one of the text-to-speech programs, such as a screen reader. The screen reader highlights the words as it reads them. Noah has difficulty with both speech, focus, and writing. We believe that Noah would benefit from calming tools such as a stress ball or sensory activity due to his negative behaviors when his electronic is taken from him or someone attempts to take off his coat. He does receive a timeout. Perhaps calming tools and strategies will minimize or prevent such actions. We believe that Noah would benefit from role-play activities to improve retention, comprehension, and focus due to active engagement. We believe that Noah would benefit from peer involvement. He is quite social and outgoing. We believe Noah would benefit from enlarged print material, color contrast handouts, and preferential seating to accommodate his vision problems to enhance participation. We believe that Noah would benefit from an eye exam in order to identify the extent of his hypoplasia to provide the appropriate accommodations for assignments and visuals. We believe Noah would benefit from an audiological exam to assess his hearing since there is not an updated exam. This current exam will assess his hearing in order to make the appropriate recommendations during activities at school and at home. It is recommended that children with cerebral palsy receive yearly eye and hearing examinations. We believe Noah will benefit from a reevaluation of his communication devices because the grandfather stated he is not able to express himself at times and it leads to hitting or pitching. These accommodations and strategies are appropriate because it gives Noah an opportunity to interact more with his peers. The use of the devices and supports will assist Noah instructionally, and the modifications suggested will increase his productivity in the classroom. Summary and conclusion. Education for children with cerebral palsy is as important as any other child's education. Therefore, we have included suggestions that could be used for the benefit of all learners with cerebral palsy. Research has shown that the use of such varied approaches assists cerebral palsy learners to move at their individual levels. The Kaufman test of educational achievement revealed that Noah is functioning at the kindergarten level, noted as low extreme for letter and word recognition, math concepts and applications, math completions, and listening comprehension. In addition, Noah scored in the extremely low categories for verbal comprehension, perceptual reasoning, and full scale. Overall, Noah has a low adaptive score and his communication and daily skill domains are low as well. He has a moderately low score in socialization, but adequate levels of functioning in coping skills and receptive Communication. Noah's upper extremity function is moderately impaired and affects his ability to do bimanual tasks, hold and use a variety of utensils, and complete self-care tasks. The Ontario Teachers Federation published an article about teaching strategies for students with special needs. The article has included a plethora of strategies teachers can use for Noah as well as other children diagnosed with cerebral palsy. The authors recommended students that demonstrate difficulty with fine motor skills would benefit from a pencil grip in the school setting. Also, they recommended the use of graphic organizers to focus on the main ideas of a lesson. Lastly, the article suggested the benefits of low, mid, and high-level technology used to assist students throughout the school day. As a special educator working with students diagnosed with cerebral palsy, it is important to incorporate bimanual activities throughout the school day. Debretto, Brandeo, Gordon, and Mancini conducted a study comparing constraint-induced movement therapy and hand-arm bimanual intensive therapy with 16 children diagnosed with cerebral palsy. The study evaluated self-care, play, and school activities per child, and each program was implemented for 15 days, 6 hours per day, and the parents performed a 1-hour session at home. The results revealed that both habit and CIMT increased independence of children, but the habit children showed greater improvements. Lesson plan. Grade level and class, primary K through 3rd grade. Subject area literacy. Lesson title, topic, fact or opinion. Instructional objectives. 1. Students will be able to distinguish facts and opinions. 2. Students will be actively engaged in group reading activities with purpose and understanding. State standards are listed as follows. Materials and resources. Graphic organizers, computer, smartboard, brain pop, instructional and or assistive technology devices needed. Fine motor assisted device, fact and opinion signs. Description of instructional activities. Introduction. Tell students that today we are going to learn about facts, true statements, and opinions, which are personal views or attitudes that might change. Activate prior knowledge by asking questions. For example, what is a fact? What is an opinion? Have students write the words fact and opinion and copy down the definitions on the handout. Instructional delivery and implementation. Demonstration and modeling. Draw a KWL chart on the smartboard and have students tell you what they think they know about children with special needs and what they want to know about them. Students will watch a brain pop video on cerebral palsy. Checking for understanding. Make check marks next to questions that are facts or opinions on the KWL chart. Guided practice. Students will turn and talk with a partner answering the question, is it a fact or is it an opinion? Distribute fact and opinion strategy sheet and practice the first question as a group. Answer any questions students might have. Review KWL chart for fact and opinion responses. Independent practice. Ask students to complete the fact and opinion handout. Closure. Remind students of the definitions of fact and opinion. Have students reflect on the importance of distinguishing facts and opinions. The assessment and evaluation. Assess students through observation of interaction during the KWL chart, turn and talk activity, and quiz at the end of the video. Instructional adaptations. Teacher aide will read the questions and students will respond by raising the sign fact or opinion. The aide will assist the student using hand over hand to circle responses. Students will point to one new fact learned during the lesson, and the aide will add to the group chart. Teacher assistant will support special needs students with hand-over-hand simplifying the definition. For example, a fact can be proven, an opinion cannot. This strategy will lessen the amount of writing for the student. Strategies to meeting Noah's needs. Pair Noah up with another child that is carefully chosen and find activities in which Noah can be an assertive and contributing partner. Although his speech is not always clear, he does have verbal skills to draw on and has augmentative communication device. Another child can help him with motor skills while using the KWL chart. Noah can provide verbal or pictorial input about his ideas, and his peer buddy can write his response. This will give him a sense of autonomy. Develop an enlarged KWL chart to use at his seat with a color contrast handout. Preferential seating. Provide frequent breaks between activities. Paraprofessional support. Provide a pencil grip for his fine motor skills. Textured sight word cards to enhance vocabulary skills. Program sight word app into his Nova 10. Count the number facts that were provided as a class to accumulate the lesson. Independent tasks provide with 100% reliance on peer buddy or paraprofessional. Sensory caddy or calming tools. ABC analysis chart as needed. Check for understanding cards, where red means I do not understand, yellow means I understand a little, and green, I understand. These are the following resources that we had used to guide us during our recommendations, accommodations, and modifications. And these are our resources continued as well. Thank you so much, and I hope you enjoyed our lesson plan as well as our recommendations, modifications, and accommodations we have suggested for Noah.